Joining us now from Ohio is Steve Sosebee, Executive Director of Heal Palestine and also the President and founder of the Palestine Children's Foundation. Steve, thanks very much for your time. What's your assessment of the current situation, or your understanding of the situation regarding the Rafah crossing? Partially reopened, and now it appears it's been closed.
Yeah, I think it's just another indication that this ongoing crisis, whatever you want to call it in Gaza, it's worse than a crisis, obviously, is affecting the entire population. There are nearly 20,000, as you reported, people in need of urgent medical care in Gaza. The health system's been targeted. It's been mostly destroyed. The quality of services there are very limited due to the destruction of the health system, the inability for doctors to get access to medical supplies, medical equipment, the killing of hundreds of doctors, nurses, first responders. The entire health system has been under siege and destroyed, and therefore these patients need access to care that they cannot get inside of Gaza. And closing Rafah again after only opening and only 5 injured people were able to get out since it's been open is just another indication that the Palestinian people are under this tremendous pressure and that the international community is failing them. We've not stepped up and given them the support that they need to treat their patients or to overcome this horrific situation that they're in.
And when we talk about the international community, key to all of that, of course, is pressure from the United States or lack of. That's the only thing that will necessarily move Benjamin Netanyahu's government in Israel. What more should the US be doing right now to try to push the peace process forward?
Yeah, I think there has to be clear red lines when it comes to what U.S. policy is and what they're permitting the Israeli government to get away with in Gaza. Certainly bombing civilian areas and killing innocent civilians, including children, as we've seen over the last couple of days by the dozens, is something that the U.S. government should not tolerate. Those are our weapons that are being used, and that we have to put clear guidelines and clear restrictions as to the use of those weapons on innocent civilians. In addition to that, this ongoing closure of aid and denial of medical supplies and people who need to get out. The U.S. needs to facilitate that, needs to push for it, needs to ensure that this border is opening and that some of those nearly 20,000 urgent medical cases are able to get out, get into Egypt and go on to treatment centers where they'll be able to get life-saving care, hopefully.
And look, where do you stand now on the current situation? Clearly, it's a desperate situation for Palestinians. They need an end to this situation. They need medical care desperately. But Gaza's medical facilities have been reduced to almost hardly operating whatsoever. How long is it going to take to rebuild that infrastructure?
Well, that depends on the international community and the Israelis allowing basic medical supplies, medical equipment, building infrastructure, building materials to enter Gaza and start that rebuilding process. We haven't even begun that process yet. They haven't even discussed getting the basic materials in to rebuild Shifa Hospital, rebuild the European Hospital, Nasser Hospital, the Hamid Hospital, the Rantisi Hospital, all of the pediatric hospital, all of these institutions and hospitals that have been bombed and destroyed over the past 2+ years. They need urgent effort to start rebuilding them and ensuring that access for patient care, access for equipment, supplies, medication starts right away. It hasn't started. Therefore, people continue to die in Gaza from diseases, from injuries, from ailments, which could easily be curable in a normal health environment, which Gaza never had a normal one, but certainly was able to treat those patients more than 2 years ago. And now, due to the destruction of the health system, those patients are not able to get care. And until the borders are open, at least to allow humanitarian aid, medical aid to enter Gaza, people are going to continue to die there unnecessarily.
Steve, we thank you for your analysis. Appreciate you coming on TRT World. Steve Sosebee there joining us from Ohio.